Starting our lecture Popliteal Fossa and its contents. As we will move on, you can see that learning objectives is describe the boundaries of popliteal fossa, contents of popliteal fossa, and clinical application. So let's go to our visual lecture. Let's move with the boundaries. So if we look here in the picture, you can see that on the lateral side, on the superior side, it has one muscle, that is biceps femoris, and on the medial side, that is superomedially, it has two muscles. This is one is semimembranosus as shown here in the purple color, and if we remove semimembranosus, we find a small muscle known as semitendinosus located just below the semimembranosus, and this is biceps femoris on the superolateral side. Inferiormedially, on both lateral side and the medial side, we have one major muscle, that is gastrocnemius. Lateral side is occupied by the lateral head of gastrocnemius, and the medial side is occupied by the medial head of gastrocnemius. Below the lateral head, there is one more small muscle or the tendon of a small muscle that is known as plantaris. So coming on the roof, as we see in most of the fossa at the different anatomical places, the first structure what you face or find out if we go on the dissected cadaver or during the dissection and the human body, this is skin. Within the skin, once you remove the skin, you will find superficial fascia that consist of small saphenous veins, terminal branches of posterior cutaneous nerve of thigh, a nerve that is supplying the posterior part of the thigh, posterior division of medial cutaneous nerve of thigh. Here you can see the posterior division of medial cutaneous nerve of the thigh, lateral sural nerve and medial sural nerve. These are also two cutaneous nerves. Here you can see the sural communicating nerves, and this is one small short vein known as short saphenous vein, and here is a posterior cutaneous nerve of the thigh, one of the major cutaneous nerves present on the posterior compartment. Now here, after removing the skin and superficial fascia, you can find a deep fascia that is very thick and strong. Here it's known as popliteal fascia. In the roof here in this picture, you can see there's a great saphenous vein, the branch coming up, and here is a small saphenous vein, and these are the divisions of the nerve coming here. Sciatic nerve at the tip or the apex of popliteal fossa, dividing into tibial nerve and common peroneal nerve. And then from common peroneal nerve, you can see the branches once arising known as lateral sural nerve, and from the tibial nerve there is a branch arising known as medial sural nerve. Now once finished with the roof and we show you the boundaries, now coming on the floor. So what did you see in this picture? If we just look on this picture, one of the ligament known as oblique popliteal ligament, second is a popliteus muscle. So if we remove oblique popliteal ligament and popliteus muscle, what did you find here in this picture? These are the popliteal surface of femur, and here is a small bony part of the tibia, also capsule of the knee joint. After that you have oblique popliteal ligament and then popliteus muscle, and this popliteus muscle is covered by a thick fascia, that is a popliteal fascia. So these are the contents of floor, or sorry, the structure that is forming the floor. Now moving to the contents, you need to remember in a sequence that will be more easy. So let's start from the lateral to the medial side. I will prefer to go from the picture. So laterally, what did you see here? in the picture is common fibular nerve. The other name of the fibular nerve is a peroneal nerve. So we can say common peroneal nerve or common fibular nerve. After that, also the second is nerve. What is this nerve? Tibial nerve. So two nerves. First, definitely the fibula is on the lateral side, or the peroneal part is the lateral one. So the first one is fibular nerve. The second one is tibial nerve. Now popliteal vein and then popliteal artery. So this is a sequence from lateral to the medial side of contents. Now relationship of contents. This is just a little bit detail of what we have taken it in the previous slide. As you can see in the picture, the sequence is common popliteal nerve, common peroneal nerve. Then we have a tibial nerve, then popliteal vein, and medial most is a popliteal artery. So let's start here. You see the first, the sciatic nerve. Just at the apex of the popliteal fossa, this sciatic nerve is dividing into two parts. One will be the tibial for the medial side, and the second one is a common peroneal nerve. Now the tibial nerve is much thicker and the larger, supplying a major components. So how the tibial nerve is passing? It continues behind the gastrocnemius muscle and finally exiting the popliteal fossa. But this common peroneal nerve, it follows the tendon of biceps femoris on the lateral side and then winds round the head of the fibula. If you remember that when we are taking the osteology class and while talking about the tibia and fibula, I've told you that this common peroneal nerve has an important relationship with the head of the fibula, and it is one of the nerve that is commonly damaged or injured if there is an injury on the lateral side of the leg, just close to the knee joint. So here again, we are still on the contents, but the relationship of the contents. Now we are on the artery. What is this? Popliteal artery. So the popliteal artery is the extension of femoral artery. Once it comes out of the adductor canal, then this is now known as popliteal artery. Now at the termination, this popliteal artery, once passing through the popliteal fossa, is dividing into branches. So first branch is anterior tibial artery, as you see here. This is anterior tibial artery that's going into the anterior part of the leg, passing through the interosseous membrane through here. And this one is a posterior tibial artery. And one small branch that is known as popliteal artery came up to supply the knee joint and muscles of the thigh and calf. So this is the articular branch. So deepest most structure is artery, and it's accompanied along its length by the vein. Now coming on the tibial nerve, this picture I have taken it from the CanHub, one of the learning resource. Usually we use its videos in our practical sessions. So you can see here, this is a sciatic nerve, the point where it is turning or changing its color. It's now becoming a tibial nerve. So it passes through the popliteal fossa. It passes through the popliteal fossa and then coming to the arch of the soleus. So in the popliteal fossa, it gives the branches, goes to the gastrocnemius, and then it's passing to the popliteus, soleus, and plantaris muscles, and also an articular branch to the knee joint. The cutaneous branch will convert it into a or becoming a sural nerve. So here you can see the branches that's going in the popliteal fossa. All are the branches coming from the tibial nerve, and tibial nerve itself is a branch of the sciatic nerve. Now the common peroneal nerve, this interesting relationship as we discussed before also, it's winding around the neck of the fibula and passing through the head and winding and division into branches. See here PL, also known as fibular nerve or peroneal nerve. So first of all, it's descend obliquely on the lateral side of the popliteal fossa. When we are talking about the relationship, you see this is the lateral most structure. As you see, this sciatic nerve here behind the femur is dividing into two parts, tibial and common peroneal, tibial and common peroneal, and close to the head of the fibula on the medial margin of biceps femoris. Then it passes between the tendon of biceps femoris and the lateral head of gastrocnemius. So here common peroneal nerve, and then it's turning around the neck of fibula and passing between the peroneus longus. Finally divides into two parts, superficial peroneal nerve and deep peroneal nerve. And it's supplying the peroneus longus and peroneus brevis along with the short head of the biceps femoris. So let's go back again to our learning objectives. We have discussed the contents, we have discussed the boundaries. Now we are on the clinical applications. So starting with the term popliteal block. What do you mean by popliteal block? If you look here in the picture, this is from the surface anatomy showing a point where through the help of the needle, the sciatic nerve is blocked at the level of popliteal fossa. Usually it's used or indicated for the surgical procedures, performing below the knee, foot and ankle surgery, repair of the Achilles tendon, and sometime taking a biopsy from the sural nerve. This is the other picture. Here you can see in the popliteal fossa, there is a thick ballooning and the rupture of the artery filled with the blood. So what happens here? The condition is popliteal artery aneurysm. You know what is aneurysm? It's a widening of the artery where usually the weakening of the arterial walls, either intima media or adventitia, leads to the dilatation and sometimes the rupture. It's usually discovered during the routine physical examination. Smoking, hypertension, males, gender, advancing age, and sometimes arteriomegaly, these are the increase or the predisposing risk factors. Clinical presentation, you will find an asymptomatic pulsatile mass that can be felt during the popliteal mass on the popliteal fossa during the routine examination, and sometimes it leads to the acute limb-threatening ischemia. So usually popliteal artery aneurysm can be confirmed by using an ultrasonic examination for its size, its presence of the clot. Now here in this picture, you can see a small cyst in the popliteal fossa. This popliteal cyst is also known as Barker's cyst or the Baker's cyst. It most commonly occur in the adults. So how it is present? It presents as a swelling in the popliteal fossa due to the enlargement of the bursae present close to the gastrocnemius and semimembranosus muscle. And this bursa is lying between the two muscles on the medial side of the fossa between semimembranosus and gastrocnemius muscle. Now here in this picture, there is a small guy is standing and you see the popliteal fossa from behind. And these are the two enlarged cysts. These are known as popliteal synovial cysts. Usually asymptomatic. Sometime it has been discovered on imaging studies. Risk factors, there might be a history of the trauma or history of joint disease. The common known knee disorders usually. Rheumatoid arthritis and meniscal tears can also lead to it. How it is diagnosed? When you ask the patient to stand and you are able to see the popliteal fossa, a popliteal mass is visible during the inspection and it is prominent in the standing and once the knee is fully extended. As you ask the patient to flex his knee to the 45 degrees, the swelling gets soft and it will disappear. And this condition or this disappearance is defined as Faucher's sign. As you see, the tension is relieved, you will find the disappearance of the mass. And once ask the patient to stand in the fully extended position, you will find it on the medial side, a bulge. So let's quickly summarize our lecture. We talk about the popliteal fossa. So if you just quickly recall, in popliteal fossa, we talk about its boundaries and after boundaries. We talk about the contents. So what are the contents of the popliteal fossa? Popliteal artery, popliteal vein, tibial nerve, common peroneal nerve, relationship of all the structures starting from the lateral to medial. Then in the clinical application, we talk about the popliteal block, we talk about the popliteal cyst, we talk about the examination of the popliteal cyst, and also the popliteal artery aneurysm.